keynote address by His Excellency Lieutenant General Dahiq Al-Fan Tamim, General Command of Dubai Police. And his speech will be on history of quality in Dubai Police. I welcome His Excellency Lieutenant General Tamim here. And I'm really thankful to him for accepting our invitations to meet IGP, Inspector General Police Sri Lanka, and he had a meeting yesterday with him, and I heard it was very successful, and thank you very much for accepting our invitation. And you all know that Lieutenant General was recognized for his contribution for the promotion of quality, and not within an easy organization, it's a Dubai Police. And so he has brought the Dubai Police into that level with his commitment and sacrifice. So he had been recognized at our, on 14th at the APQO award ceremony. So he had done a lot for the promotion of quality. So it's a privilege for us to have him here today. And I invite HE Lieutenant General Tamim to make his presentation on history of quality in Dubai Police. Thank you.
Ladies and gentlemen, good afternoon. During the next 30 minutes, my presentation it will be about the history of the quality at Dubai Police. In the race of excellence, there is no finish line. His Highness Sheikh Mohammed bin Rashid, the Vice President and Prime Minister and ruler of Dubai, Dubai Police had officially started, ladies and gentlemen, adopting the concepts of terminologies of quality and excellence as early as 1998. Dubai Police experience of quality and excellence, so it implementing concepts such as TQM, strategic planning, and strategic elements, customer focus and customer satisfaction, continuous improvement, quality management system, ISO 9001, and 14 and 1 and 18 and 1, Six Sigma, quality models such as APQO, Dubai Excellence Quality Awards, knowledge management, and process mapping. From 1999 up to 2001, we are setting up quality culture through the organization structures, quality assurance sub-department, annual quality newsletters, or newsletter actually, quality culture series, specialized training of quality officers, idea center, and self-assessment system. The period actually starting from 2002, which is the beginning of the excellence, launched of APQO College, and now renamed as a University of Hamdan, actually Hamdan bin Muhammad bin Rashid College, a new modified self-assessment system, performance indicator system, mystery shopper, process management system, partnership system, and knowledge management, police best practice, standardization of the sections. We start with the standardization sections and balance marking section. We are starting comparing ourselves with the other forces as Singapore police and other police in UK and other countries. Membership, the period from 2004, actually we are starting World Excellence. We are starting as a membership in IDES UK, membership in BS, Burj Al Arab Quality Declaration, Excellence Research Center, founding members of we call it Mecca, MEQA, ISO 14001 and 18001. Transferring the Dubai police experience to United Arab Emirates and the region through the Arab countries, participating members of APQO, winning first place in the golden category of Dubai Government Excellence Program, winning the renowned International Quality Century Award, and winning also a Strategic Planning Excellence Award, and winning Community Policing Award from United Nations. Now, to know Dubai Police exactly what is the difference between Dubai Police and other organizations within the organization of governments or among the organization of governments, this is where is Dubai Police. Here. So actually, we are leading the excellence and the quality in Dubai. Since the beginning, up to now, it's not easy to be, always became as number one. It's difficult, I know, but we are fighting and we are trying always to be the winners as can as possible. Now, see, annual target, this is the external assessment result. Our target to increase each year 3%, as you see here. but we are doing better. 2003, you saw the figures, the number, the result, 509. But 2009, we are 16 or 619 our result. This number, still there's no police over the world getting this result. So we are so happy that we are achieved this figure. Dubai Police won 67 of total of 173 awards, which is the government, Dubai government excellence program, give it to the departments. So nearly 39% of the awards, we are the winners, and we are getting that much of the awards. Anyhow, distinguished team performance, distinguished administrative and distinguished technical projects, distinguished government employee, distinguished specialized employee, and so on. So actually, as you saw here, the result, 39% of the total awards we are getting from the total awards, which is 173, as you know. Now, the Minister of Interior, there is award of Minister of Interior, Dubai Police, getting from the total 27, 19 awards, and the other 7 it's given to the other 6 forces. We are 7 forces in the United Arab Emirates, so nearly each force in United Arab Emirates, they got only 1 award, and we are getting that much, 19. So 70% of the awards, we win it at the first period when the Minister of Interior decided to let us dealing with the excellence programs through the whole Minister of Interior. Anyhow, here you are going to see the customers, how they are feeling in Dubai. The survey, a survey that it's done by the Community Development Authority. They are, third part actually. It's not done by the police. But look to the result. 94 of the locals of the United Arab Emirates people, they feel safe in Dubai, and other nations of Arab countries, they said 92, they said we feel safe in Dubai. Asian, 91%, they said we are feel safe in Dubai. But the European and the Americans, 98%, I can see it from here. Let me to wear my glasses. That one, yes, at the last. This one, 98% of the European and the Americans, they feel safe in Dubai. Now, the way we do our business. We are starting with the awarenesses, quality, culture, and measurements, self-assessment, and improvement, continuous, and so on. So, with this circle, actually, we are doing our job. Now, awarenesses, specialized training programs, workshops, seminars, etc., to all aspects, quality and excellence. All subjects were given to the different ranks in the excellence and quality management. Anyhow, training all managers and deputy managers various concepts of quality, especially strategic planning, change management, and performance management. Specialized training for front-line employee. We start actually in this training because it's so important for any visitor coming to the police station, the employee who is in the first line. If this is doing his job perfect, then the customers, they will be happy at the end. But if he's not, doing his job as must should be done, then the problem is starting. Training about 120 officers on the Six Sigma continuous improvement methodology, green belts, and 16 head of departments to champion level. Specialized training programs for quality officers leading to be an expert and qualification, to be as expert, and they can, we can recognize them as experts, not just internationally, not locally, to be over the world known as an experts in their fields. Now, the measurement, for example, we are starting with the Public Opinion Center. And at the beginning, people, they were, actually saying, what you meaning, for the Public Opinion Center? Because this is the first Public Opinion Center in United Arab Emirates, starting from the police, phoning to the people, asking them, and listening to them, and getting the answers, either yes or no, happy or unhappy. So before that, actually, the first department or the first place opened the Public Opinion Center in the whole United Arab Emirates in Dubai Police. And when you start from the police, this is something good. If it is, this center, public center is, done by the other civilian departments or organizations, that's something else. But when we saw nobody is, taking the opinion of the people, we start as a police. And we lead them to this standard of services should be done through the government's departments. Anyhow, I will try to go fast now because the time is passing, I'm sure. Suggestion and complaints, schemes, self-assessment, ISO audits, and mystery shopper. Through the whole these things, we are, making our measurements, and we established this public opinion center on 19 February 2001. Now, other way to measurements, the people, suggestions, and their aims, and what exactly they want from us. So our motto, unleash your thoughts through the whole facilities, which is nowadays, telephones, internet, and nowadays with the Twitter and Facebook and so on. So actually we are, measuring our services through these tools. Let us now to go to the Dubai Police Balance Scorecard. We are starting with the process, goal achieved, and customers and employees. So within this rules, we are making the balance scorecard. Let us to go to the continuous improvement. How it's done in Dubai Police. Comprehensive process map, strategic map, key performance indicators, functional performance indicators, balance scorecard, and self-assessment, mystery shoppers result, and customer satisfaction services, or surveys actually. The Six Sigma in Dubai Police define then measure, analyze, improve, control, and transfer. We in the Samyum, we are the actually each year there is international symposium for the best practice over the world. Through this symposium, we are actually spreading the culture of excellence, activating the role of discussion and debate, supporting partnership and cooperation, and strengthening existing ties, and creating new partnership, MOUs, documenting best police practice for all around the world, and make them available for all. Let us to see now the total strategic element. Now, here you will show the strategic objectives of the Dubai Police, reducing the crimes, for example, and then key performance indicators. So we decided how much should be reduced the crimes or the traffic death on the roads. For example, before 5 years, the figures of the people whom they are killed on the roads in Dubai, 21% per 100,000. And now 3.5. We are too close to the Scandinavian figures. But our aim, 2020, to achieve 0. And then my friends from Sweden, the police there, they phoned to me, they said, you are crazy. It's not possible to achieve 0. I said, I will try. Why not? Let us to be doing something hard. Targets and doing as possible to achieve because if we are reducing from 21% per 100,000 population, so up to 3.5, I think we are too close to the 0, and we hope achieve our aims. Core process and the weight of each of the strategic objectives. These weights actually done by the expert in Dubai Police, and before there is no weights actually for these things, but we are trying to do our best to do as can as possible, and we ask the officers specialized, whom they are specialized in this field, and they give these figures to, for example, crime prevention. They give the, from the total weight, they give 30, nearly 31% as a weight from the whole, security. And then support processes. So there is another departments whom they are not to prevent the crimes. It's not the core business for them. They are just supporting the other departments. So the support are also there. Palladium Hall of Famous we enter because of actually this elements which is done by the specialized and the officers whom they were give that weights. Now, we know Dubai Police as a local, but the Ministry of Interior, they are doing their strategy. So we are trying also to work with them together to achieve the same targets, because if we are doing something else in Dubai and in other Emirates they are doing something else, it is not the right way. So we are trying also to link Dubai Police with the Ministry of Interior strategy. And on the other side, we are through the Dubai as Emirate, doing the same aims, which is they give it to us. They said, for example, if they want to reduce the crimes in Dubai 10% or 15%, we're supposed to be able to answering or achieve the targets which is the mentioned. Anyhow, now it's this which is coming now. It's too important, not for me, but for everybody here. Actually, we are, transferring the knowledge now to more than 52 organizations, either in Dubai or in the federal, locally or federal. So our role with the Nationality and Residency Department, the Public Prosecution Office, Dubai Civil Defense, United Arab Emirates, this is Federal Ministry of Interior. So Ministry of Interior also, we are supporting them. There is more than 100 officers there. They are supporting the whole Emirates from Abu Dhabi to Fujairah. And our role with the Federal Ministry of Public Works, also Ministry of Social Affairs, Ministry of Justice, Ministry of Financial. Now, the whole places, our officers from Dubai Police, they were, leading them and teaching them and helping them to be in the excellence race, which is Sheikh Mohammed. He's wanted from everybody there. Now, Ministry of Culture also, of youth and youth. So I'm not mentioned to other actually places which is in Dubai, but exactly 52 federal and local departments, they are, we are transferring the knowledge to them, how to deal with the excellence and with the quality and what to do to give the new and modern services to the everybody, not locals only, everybody whom they are in United Arab Emirates. Now, the most important awards, which is we get it from the different places. We got the Ideas America on September 2011. And this is an award from the United Nations regarding the child rights in United Arab Emirates, because we are looking after the child very well. And this is the golden bin. It is the first time given to they said, to the military or police. Before, it's only given to the civilians. And they told me in the United Nations, you are break the rules. That is because of the Human Rights Department, which is in Dubai Police. We established the Human Rights Department, and at that time, I received so many calls. People, they were surprised how, human rights section or departments or administration in the police, impossible. We said, why not? If all the commanders of the police, they are not, take care about the human rights in their departments, why we are not be the first department where they are, starting with this administration and trying to check our departments, police stations, checking our patrol cars, they are, take care about the human rights during the time when they are, doing their duties or not. The prisoners whom they are sick, blood pressure or any problem they have, they are getting their medicines in the right time? Or it's, the medicine skipped for many hours till they got their, medicines to take a long time. They are treated right or not? Anyhow. But when you are doing your, core business, it's normal, isn't it? What about when you got a medal and you fight against the AIDS as a police? This is something maybe strange, but we do it in Dubai. And this is the Deputy Secretary General of the United Nations and Executive Dr. Peter, actually. If you will go to the internet and put his name, he's a very famous gentleman. When he gave us the medal, he said, allow me to give you military salute for your job which is done, because we start awareness of people against the AIDS 1985. He said at that time in Europe, nobody is thinking, even the hospitals or the health departments, they are not thinking to do any education regarding this problem. How you do it in the police? Anyhow, this is the quality management system, ISO 9001. The whole force from the headquarters to the police stations, the whole administrations, all police stations, at once we got ISO, and that's not happened in any force before. I mean, we checked and we found either 2 or 3 administrations, they got it at once over the world, but the whole force from A to Z, they are getting the ISO. Nobody, it's not done before. but it's happened in Dubai police. Anyhow, now let's go back to the 18 and 1 and 14 and 1. We are actually planning now to integrated quality management system, and that it will make the lower running cost, reduction human resources required, and reduction in duplication of work also. This is the Century International Quality Award, which is we got it in Geneva, 2009. And this is the Excellence in Strategic Planning from, we got it from Paris. And now something strange. This is, I don't know if you know exactly Dubai or not, but this is Sheikh Zayed Road. We call it Sheikh Zayed Road. This is 1990. This road between Abu Dhabi, Dubai and Abu Dhabi, it is desert. This place is out of Dubai, heart of Dubai. It's out in the desert. Now, I want you just to know, ladies and gentlemen, how these programs, the government, Sheikh Mohammed, when he decided to go and plan and start with the strategic plan, not only doing, as you know, budgets each year, and we spend it, and we don't know where to go. He decided we must, he said, starting with the, strategic plans for the country. So, actually, this is desert. Look now, after 10 years, ladies and gentlemen, now this is the heart of the city of Dubai. Before, this road is so far, and you are out of the heart of the city of Dubai. Here, actually, just we'll go back. Just in this side, the tallest building, Burj Khalifa, which is known for everybody now. And this is within 12 years. The photo, the view, the building, the system, the programs changing. And thank you very much for your attention.
Thank you very much, HE Lieutenant General Tamim, for your valuable presentation, and I hope that many audience here got some new insights, and how the police had been in Dubai had been developed to today's level. And so, thank you very much once again. And there is a special event going to happen. So I call upon Shan. The Shan Ruprai, President of Asia Pacific Quality Organization, and Dr. Charles Aubry, the Chairman of Asia Pacific Quality Organization, to come forward. and also Dr. Sridhar De Silva, President of Sri Lanka Association for.
This from the United Arab.
So next session is the plenary session 3. The theme of the plenary session 3 is strategies and approaches for productivity, innovation, performance excellence, and superior customer experience. So for this session, moderator is Mr. Hanek Singh, Vice President, Singapore Technologies Engineering Limited, Singapore. I call upon Hanek to come forward. And the panelist will be Dr. Charles Aubrey, Chairman, Asia Pacific Quality Organization, and Dr. PKCL Jayasinghe, Director, General Ampara Hospital. I invite 3 of you to come. And I request you all to make this a very interactive plenary session because the expectation is that you ask many questions and because those are eminent presenters, so don't let them just go and you ask as many as possible questions. Come.
Hi, Bhavan. Good afternoon. Dr. Charles Aubrey, Chairman APQO, Mr. Shan, Ruprai, President APQO, Dr. Sri Lal, President Sri Lanka Association of Quality, Mangalika De Silva, Chairperson for the thing, Excellencies, international guests, fellow friends. This sharing session is about customers. We all agree you are our customers, and we will do our best to give you a good experience in this presentation. And this presentation, we are going to be talking about the link of productivity, innovation, and also performance excellence that brings about customer experience. Normally, there are 3 Ps that enables customer experience. One is the physical part of the organization, the people and the processes. Me, as a moderator, will give you a quick preamble about what we possibly will be covering, and then Dr. Charles Aubrey will share his inputs on customer experience, and Dr. Jayasinghe will come to share also from the hospital perspective. Dr. Charles Aubrey is a very experienced person, in fact, an expert in service, and he has worked in banks, he has worked in consultancy companies. Those of you who read his CV is so long, I may not have enough time to go through. And also, he has served the Navy. And having worked in the Navy is, in the logistic aspect, is also a service-related job. So in terms of experience, I think he's about 99.99% there. Next is Dr. Jayasinghe. He has enabled his hospital in Ampara, Sri Lanka, to focus on customers and bring about a level of customer satisfaction, which is superior in its performance, and he'll be sharing some of his findings and, of course, what they're doing to bring the level even higher. Here, use this. Can somebody help me? Which side is working? This side working? Okay, fine. The first thing that we want to know is customers. Who are customers? We can say customers is king. No customers, no business. Just like the Dubai Police Force, His Excellency shared earlier, how they took care of the people, the citizens, the tourists, the guests, so they give a very good experience in Dubai. And I would think that's why the world knows Dubai so much now as an excellent place to be in. Why is this important to us? Why is taking care of customers and customer experience important to us? Because in today's context, everything is about customer experience. It's experience that customers have that makes them decide whether they continue to do business with you or not. And it is so simple to delight, but yet it's so difficult to delight customers. So we must be able to focus on what's important to us. So the important, I don't know the slide for it, huh? Can you go to the next slide now? Okay, this is the next slide, okay, fine. Okay, why is it important? Because today is the real-time economy. In the real-time economy, there are a couple of things which are important. Ideas, technology, and information. So this is what will make you succeed. Why ideas? Because there's so many people who know what is happening, and ideas come about, innovation takes place. So the ideas keep improving. Better and better ideas come on board, and you must be fast and quick. There's technology that enable your competitors to use and outrun you. And of course, information is getting cheaper, so you use it. There's so many ways of getting information. So because of this, the real-time economy is so fast, you have no choice but to focus on customer experience and, in fact, own the customers. That's the best way you can do. So what does better, faster, cheaper helps you to do? Being on time, on target, and within budget. And this is what the public sector organizations will have to comply. Your budget shouldn't burst. And of course, you want to get the right things right, to the right places, at the right times for profit or with savings. So you bring about delighted customers. Customers get what they want, and in fact, they get a good experience with you. So to get superior customer experience, it's important that we make sure that we innovate. And when you innovate, it brings about new, better experiences for the customer. You leverage on the performance excellence framework to check every angle of your organization to make sure that they are ready to serve the customer. And of course, that will help you to improve your productivity, and your margin goes up, and the customer gets a good experience, and that brings about superior customer experience. And you typically involve the customers in every aspect of your operations. And then you know exactly what the customer is talking about or feeling about, and that makes it easier for you. Right from leadership, you can keep going across all the way. Even your board of directors can engage your customers. You know. So the can-do attitude is very, very important in all our colleagues, wherever they're working, and they need to go the extra inch. Sometimes they go the extra mile, nowadays you go the extra inch. That makes the difference between you and your nearest competitor. So if you look at quality, what is good quality? Typically, the length of the organization, you're looking at your products, you're looking at your processes and your people using it. Normally you focus on that, you think you have a good product, you think you have a good process, you think your people are trained. Is that enough? May not be, because when the customers, they look at the outcomes, they look at the benefits, and they look at the results. So you need to link these two. If you don't link these two, then there are two different parties looking at two things differently. So the quality talk is typically, throughout, is typically important to provide the customers a good impression of your quality. And if you really look at customers, they basically look at a total package. They don't care about the different parts of the organization. And if you really look at the quality, it extends to everything, right? From the receptionist to being greeted in and meeting the boss if you're going for a meeting, everything covers and gives the customer the experience. So every department of the company or every division of a place needs to be engaged in ensuring that customer experience is enabled. Really, if you look at this customer's perspective, and you may say that okay, sorry. You may say that if you go to a particular place, registration is important. Come and register, we register you very quickly. But the experience in the organization is registration time must be fast. But the customer comes, it looks at everything, from the time you're driving there, to parking your car, to the lobby time. The whole thing is a customer experience. And you must make sure that every part of this gives the customer a good feel when they leave the organization. So the shift today is no more from customer service, just customer service, they're moving to customer experience. Because we own the customer service, but the customer owns the experience. So whatever strategy, whatever people training, operation, whatever you do is yours. But you cannot manage the experience. It's the customer who will experience it. So that's why it's very important to make sure that we look at how we provide the customer the experience which we want to provide. I think this just very quickly, innovation productivity will help you to get there. So your processes must be more efficient, and you must get your people to work faster, quicker, and you must equip them with the right trainings and make sure that they fit into the environment and they work as a team. And for performance excellence, you are able to look at the whole organization to make sure that you're able to provide ever-improving value to your customers. And of course, improvement in your organizational effectiveness and capabilities would enable that to happen. And your organization must continue to learn. And if people also learn, so together, collectively, the people build their competencies, the organization builds its capabilities, you're able to service the customer much better. So the key to keep improving is sustaining the best practices, bringing on more best practices on board, and learning from those people who have been successful. Like the Dubai police have a lot of best practices. I think if we learn some of the best practices, I'm sure your performance and processes will be much better. And innovating, I think, is a part which is important. So the principles for success typically is to have loyal, happy customers. The best is if there are no complaints. No complaints is the best, and they're happy management also, because you don't have to worry too much. You can think about a strategic perspective. Happy management, you're working, you don't have to worry too much. Your employees will be happy because the management are all having tea and coffee and having good time. And of course, customers' experience are good, so they'll come back to you. So the 4 things you need to know, or perhaps customers want, is your thoughts probably. Some of you may be thinking that, family-friendly, caring service is one way. Flexibility, your feelings towards that, in ensuring the circumstances allow that. And problem resolution, how quickly do you resolve the issues which are highlighted to you, and how quickly you do a service recovery. Yeah. So the 2 pieces which are important is the business piece and the human piece. The business piece is your policies, all your procedures and programs, regulations, whatever you have, even if you're ISO certified, your work processes must capture that and enable that to happen. And then the people, so smiles and eye contacts and whatnot in your greetings, in your interactions, in your rapport, all that we have to take into account. So first impression counts a lot. I think you know that. In the first 30 seconds, sometimes you like that person or you may have some reservation about the person. It's very, very important. So give it a thought. The first time you enter a new place, what do you notice first? Right? It's very important. Impression is important about the place and about the people. So if the place is very poorly set up, you feel that this place possibly may not have good performance levels. If the people down there are too grumpy or do not reflect the cheer, then you also will have some second thoughts about what's happening there. So it counts, the people also counts, because all this brings about their customer experience. So winners, what do they look for? First of all, they want to enable, we want to make sure that they encourage innovation. Everybody gets engaged. Allow people to unleash their creativity. So people feel that they have a ownership, they have a stake in the place. Then enable performance excellence. Check every different parts of the organization, different systems and processes, and bring about productivity. And that will ensure superior customer experience. So it's just a small quote before I finish the last one. Ability is what you're capable of doing. Motivation determines what you do. And attitude determines how well you do it. I think we all know attitude determines the altitude. That's how far you're going to go. So never underestimate the difference you can make in your organization to enhance the customer experience. I think this is a part of my preamble for customer experience. And I would like to now next invite the next speaker to share his part before we get into the sharing among all of us. Thank you. I'm sorry, I think the reaction time of this is too far, maybe. Yeah? The next presenter will be Dr. Charles Aubrey, the chairman APQO. He will share with you his inputs for customer experience. Dr. Charles, please.
Well, good afternoon, once again, ladies and gentlemen. Well, this is a very broad topic that we've been tasked to talk about: strategies and approaches for productivity, innovation, performance excellence, and superior customer experience. As I read over that, I'm reflecting on Lieutenant General Tamim's remarks, and I think he should be on the panel with us. No, sir, that he has gave such an excellent presentation that has covered many of these points that I think he could provide some good comments and some good leadership. All right. Thank you, sir. I think I have a slide. Yes, I have a slide, and you'll be happy to know I have only one slide. So let me make a few remarks, some of these things reflecting, as I said, some great comments and things that the Dubai Police Department are doing are good examples of many of the strategies and approaches that I think are excellent. The first, of course, I'm just going to kind of comment on leadership and strategy. And again, as Lieutenant General has talked about, we need leaders with vision, with insight, with passion. And it's great to see a leader. And if we are going to have excellence in our organizations, we must have a senior leader with that vision, passion in their hearts and also in their minds. And one of the major things that a leader must do is have an effective vision for the organization, and then be able to create a strategy. And we had a great example of a strategy just a few minutes ago, a strategic plan that aligns the organization around that vision. And of course, the vision has to include the customer and the products, and how we can best make those products and deliver those services to meet the customer requirements, and align everyone in the organization, every policeman that we have on the force, for example, to carry out that strategic plan for the organization. And certainly we need to engage the minds and the hearts of our employees. I think the second thing that I have listed on there, how important it is for us to recruit the right people for our organization, give them the training and the tools that they need, give them the empowerment to do the things that are required in their job so that they can provide the best service or make the best products for our customers, and engage the customers as well in terms of customer service, so that we identify the requirements of our customers and make sure that we deliver them and exceed them at all times. So engaging employees, but also engaging, as I say, the customers. And that goes along with, when I'm talking about engaging customers, asking customers through various means, focus groups, intercept interviews, surveys. What are we doing that's not meeting your expectations? What do we need to do in terms of the specification and the goals and the requirements and the aspiration that you as customers have, and understand those so that we can build those into our products and our processes to deliver those to our customers. And of course, once we know what those customer requirements are, then we need to create measures in the organization, measures that can tell us, as we're delivering the service, as we're producing the product, are we meeting the customer requirements before the customer even receives the service or the product, to make sure that we measure and know that we're hitting those requirements right on the head, so that we have customers that when they receive that product are pleased with the performance of that product, or they're pleased with the interaction that they're having with our folks from a service environment. And scorecards are extremely important. Number one, it's important to measure as we're delivering the service and the product, but we also have to have scorecards that show how is that product or service performing across the organization. A service or a product goes through many processes in the organization, and the output of that process is only going to be as good as the weakest sub-process in that delivery. So scorecards help us look across the organization to see where we have our weaknesses, to see where we need to focus on continuous improvement. And so I'll say next, continuous improvement. You know, we need to have some type of a continuous improvement happening in our organization. Kaizen events, continuous improvement teams, Six Sigma, design for Six Sigma. You choose the methodology that will work best in your organization, but continuously improving is important. We have stiff competition, and that competition is looking to improve their products and their services, and so we need to make sure that ours are staying ahead of the competition so that we are a more pleasing services and products for our customers. And then we need to also look at lean. Continuous improvement is good, but also lean, to get the waste out of our organizations. Every process has waste in it. We need to understand what are those wastes of waiting time, of inventory, of overproduction, waste of human minds, and understand and look for those in the organization and root those out of the organization for higher levels of productivity and quality and customer satisfaction. And continuous innovation, looking for and discussing with customers potential new products and new services that we can offer, again, using a variety of activities designed for Six Sigma, trees, blue ocean, whatever approach you like, but you must have some way in the organization to develop new products and services for your customers. So I know that was somewhat of a generic look at the things that I believe are some of the major approaches and methods for continuous improvement in order for us to have great productivity, innovation, performance excellence, and superior customer service. Thank you.
Thank you, Dr. Charles Aubrey. Next, we'll have Dr. Jayasinghe to share his experience for the Ampara Hospital. Dr. Jayasinghe.
Hi, Bowen. Good afternoon, everybody. Before starting my presentation, I must thank Dr. Srilal De Silva and Ms. Mangalika De Silva and the Organization of Quality in Sri Lanka and the APQO presidents and all other organization party, because this is giving me this opportunity is very important for us. Actually, I am director of Ampara General Hospital in Sri Lanka. My hospital is situated in 385 kilometers away from Colombo main city. But we have started this quality improvement program in our hospital, I think 10 years before. Today, I am going to present about the customer satisfaction surveillance results year 2010 and 2011. What we have done during these 10 years, but I am going to present only the result of this last 2 years. But actually, we selected to measure the customer satisfaction survey only the outpatient department in the hospital. This is the, this is the introduction. Actually, the outpatient department of the hospital is the, I can say that is the mirror of the hospital, this most important place in the hospital. The patient satisfaction is one of the most important criteria for the quality assessment, and we selected because we wanted to gather that information because existing facilities of the hospital we wanted to measure, and the assess of the quality of the busy unit of the hospital also very important for us to measure and compare the customer satisfaction level with the improvement of the quality care in the hospital. But objective of this surveillance is to identify the level of customer satisfaction and the dissatisfaction. Dissatisfaction with the service received by the clients attending the outpatient department in the General Hospital Ampara during the 1st of May, May to 1st of June 2011 in the same duration of the last year also, that means year 2010 also. This is the methodology that we have selected the hospital. That is total 384 patients were surveyed by the pre-tested self-administrated questionnaire form after the questionnaire form after the getting the informed consent and assistance given when they required. 30 patients per day during the weekdays, including the Saturday and Sunday, and excluding the Saturday and Sunday and public holidays randomly be selected during that 14 days. The results actually, if we take that sex ratio, female and male, female the year 2010 around 263 female came out for the surveillance year 2011 and 273 in 2010. There are 145 male clients came for the surveillance year 2011 and 142 came out for the surveillance year 2010. But this is if we take the age group, most important factor of this age group is majority of the patients who visited to the outpatient department, that is the age group is 19 to 34 years. That is the most important thing. But clients who are less than 18 years, there are less amount who visited to the OPD, outpatient department. This is the results of the outpatient department age-wise. Next one is the hospital visited more than one occasions. Year 2011, 394 customers visited to the hospital more than one occasion. Year 2010, 406 patients visited to the hospital more than one time. That is, if I take percentage, that is 97.8. If you take the satisfactory level, satisfactory attention received by the doctors, year 2011, 98.3, and the year 2010, 96%. That is somewhat improvement is there during this 2 years period. If we take the satisfactory attention received by the nurses, year 2011, that is 95.8, but it was year 2010, 96.6. That means somewhat reduced, that attention given by the nurses to the patient. But the assistant service satisfactory level, this is the nurses. This is the assistant service. That means minor employees and others, paramedics and some other assistant service. That is year 2011, that is 97.6, and year 2010, 93.5, somewhat increase during the 1 year period. This is the satisfaction about the time spent in the OPD. That is year 2011, 94.86, and year 2010, that is 92.3. That means during the 1 year period, somewhat increase. About the common facilities, good satisfaction about the common facilities available in the hospital. Year 2011, 97, and year 2010, 98, somewhat reduced during the 1 year period. Next one, way of the treatments. received by the patients. Year 2011, 95.1, and the year 2010, 89.4. This is the most important fact in the OPD, but during the 1 year period, it was increased. The next one is the time is spent in the drugs counter. That was year 2010, 94.2, and year 2011, 93.8. That means somewhat reduced. But ladies and gentlemen, if I come to the conclusion of my presentation, the majority of the patients visited our hospital, they are satisfied during the 1 year period that service received by the outpatient department. And these services are included with the attention given by our health staff, that means our health personnel, the treatment received from the health personnel, and the health education, and the time management, and the common facilities available in the hospital. But now, just I can show some photograph of our hospital OPD, and this is the entrance and the lobby. This is also lobby and register counter, and this is the doctor's room where the patients are examined. Thank you very much.
Thank you, Dr. Jayasinghe. Now we will start the part of the discussion. The first thing, we will have some comments or some inputs from our three honorable panelists here. The first question we would like to perhaps get your inputs on is, for the last 3 years, in terms of customers' expectations and what they are asking for, and that will bring about a good customer experience. What is the key changes in the last 3 years to now, which the customers are expecting from you, which they want to have a good experience in? So from different, maybe Chuck, who's an expert in all industries, he can choose which industry and then share something. Sir, Your Excellency, from the police force, what is there a change from the people in the last 3 years in what they are looking for?
All right, Harnik asked me if I might maybe comment from a service perspective in particular. I spent a good amount of time in banking and banking services, and just some comments about retail. I think one of the most important things is to identify your customer requirements, and some of the ways in a retail environment where we're having one-on-one transactions with customers, a number of things that we might do. Often at the bank, we would have what we call an intercept interview. So after the customers, immediately after the customers have had the transaction with an officer of the bank or a teller, we would ask them to describe for us how well we met their expectations, and actually got their verbal responses and what they felt was very positive about their experience, what was negative about their experience. And of course, then we would compile those based upon the service the customer utilized, and determine from that what things we were doing well, what we weren't doing well, what we needed to do better. Still in a retail environment, let's say something like a credit card, particularly when I was at American Express, which processes a few million credit cards, we would send customers surveys, again, first of all, transactional surveys when they were doing transactions, again, asking them what went well in the transactions with the merchant, with their billing, and the speed at which their transactions were approved. And again, always asking them an open-ended question to give us their perspective of things that we may not have asked. And again, compiling those to see how well we had done. For corporate customers, commercial customers, in many cases, we might do executive focus groups where we would make an appointment with several of the executives for a company that we're working with, providing deposit service, investment services, lending services, and talk with them over lunch, maybe a few drinks, and again ask them what were their perceptions, how well were we doing in delivering those services, what went well, what didn't go so well. Again, so we could craft what we felt were the specific specifications for those products.
Thank you. His Excellency.
Actually, during the last few years, we feel that the people not only they will be happy when you ask them what is their need, but and just you are take it and you are not doing anything at the end. They want their opinion to be, you know, to be your response to them and show them that you are respect their opinion and you do as they like. So we start in Dubai Police, for example. We said the customer, he's the director. What the meaning of directors? I told the police if some of the customers, if the customer, he's the chief of the police, and he want to renew the driving license, what you are going to do? They will finishing the license within minutes. So why it is done for the chief of the police, but it's not done for the normal customer? So there should be the services on the same standard of time. That's one. Second thing, the response time. For example, when we start planning to our response time, we found some forces over the world. Their aims, their targets, within 3 seconds, answering 85% of the calls. And I said no. We will say 90%, more than any force over the world. Within 3 seconds, the operators, they must reply the call within 3 seconds. And I remember when the young officers, they were, saying this is difficult, and if you are, think that we will, achieve these figures, and we will be better than, such a police, which is, famous one, and it's known for everybody. That's the good forces, and it is good police, and they are, since many years they are, dealing with the excellence and qualities management. I said, okay, this is our aims within the next 10 years. But I found them achieve 98% within the 3 years, answering the calls within within 10 seconds after 3 ringing to the operation room. So the response time is very important. If the customer, he will come, and then when His Highness Sheikh Mohammed, he said, I want to finishing the person when he's coming, for example, not to wait in the halls for a long time till you finished him. I visit one day I was in the municipality, and the director of the municipality, he told me, look to the hall for the customers. I saw the TV everywhere, and nice tables and services, coffee and tea, everything, magazines on the tables. It's a nice place. It is not same as the old hall, which is in the municipality. It's done decorated very well, and it's nice. And he said we are trying to finish the people within 15 minutes. So he thought that I will copy his idea, and I will do the same. But I said, instead of let the people coming to the departments, to the traffic departments, let our services going to the people where they are through the net, and he can, renew the license, his driving license through the net. So from California and Australia, our customers, they are renewing their driving license, Dubai Police driving license, and they finished their paper just like that through the net. Once they are just putting their cards and paying the what is due for us, so they got their driving license very fast. Next day, somebody is knocking, his house, his door, and give him the driving license, which is renewed through the net. So this type of services nowadays, people, they want services to done very fast. And when we are saying, we're supposed to make delivery to the our services to the houses, some of the officers, they said, so we are, Kentucky, or, what do they call it, the other one? McDonald's services, restaurants. Why you are mentioned deliveries to the houses? I said, why not? Let the people feeling that we are under the services of these people. If they are not feeling that we are serving them very well, then they will not be happy. Nowadays, people, they need the services up to their houses, up to their offices. Even if we are, as a police, our services should be, delivered to the customers where they are, either in the south, north, east, should be done. Especially nowadays, the media, the technology, and the social media is there, so you can doing the now through the Twitter. I am answering the questions of so many people, not only in Dubai, from the whole places through this. So there's Saudis, there's more than 3 million. Within the next week, they will come from Saudi Arabia to Dubai as a tourist, for example. And if there's something has happened to them, they tweet to me the problem, and I am ready to answering them on Twitter as a commander. If there is any complaint. So nowadays, you can't say, I will not answering the people, because they have the ability to reach you. Once there is, there is an account for me on Twitter or Facebook, people, they will direct contact you. If you will decide that you are, a big boss, and you are not ready to answering them, or to solving their problems, or to see exactly what is the story, and take actions, otherwise, people, they will be unhappy. Nowadays, all the doors is open, and it's difficult to be, in your office, and you are far from the problems of the people.
Thank you for sharing the customer-centric initiatives of the Dubai Police. It's very unique. I think the Dubai Police is a very unique police force. If you know how the police forces work, it's really very unique. Let's get some inputs from Dr. Jayasinha before we open to all of you. I'm sure you have heard a lot from the distinguished panel here, and do prepare your questions.
And my answer, I do agree with that other panelist, and mainly that my customers, they are the patients, mainly who are coming to the hospital. They expect mainly three things. One, the first thing is that courtesy of the staff. They, rather than getting the medication, they expect from the kindness, compassion, empathy, sympathy, and those things from our doctors and nurses. And the second thing, waiting time, less waiting time. They come and quickly get the service and go back. And the third thing in the hospital, mainly the good sanitary facilities, toilets and washrooms and those things. But because of this time constraint, I'm just going to give this short answer for that. Thank you.
Thank you, Doctor. Well, we will now open, because I think time is a bit short. So let's open to questions. Please get a mic or ask for a mic and pose your question. And if any particular distinguished panelists you are targeting it, please let you know. If not, it'll be the open question. Any one of us can fill it. Can we have the first question? You mean all the sharing so clear and everybody is convinced customer experience is important? Okay, we have a question here. Can we have a mic, please? Yeah. I can't see, the lights are really glaring. You see also.
When we discuss about the customer, we always look at the end customer. But in the commercial world now, in a B2B business, there are intermediate customers as well. And that business is depending on more on a relationship with the purchasing department sometimes. So in that kind of a situation, how do you want to address the customer satisfaction? Maybe the business owners are not in the front. They are the ultimate customers. But you have a middle layer which do the business through relationship management. How do quality address this dilemma now in business, in the commercial world? I would like to put this to Dr. Charles.
Yeah. Can we have the mic? Is there any more mics we have here? Can please?
Thank you. As I was mentioning about sitting down with commercial corporate customers, or that's B2B, when we're providing banking relationships, international wire transfers, loans, investment opportunities, and so forth for customers. And typically, what happens in that environment, or we believe should happen in that environment in international finance for customers, is that we do sit down periodically with our customers. And we do talk about the relationship and what are we doing well, what are we not doing well, and asking them is there anything they want from us that we're not already doing for them. So I think that's one of the ways that I think many relationships and customer information, customer listening posts are created by sitting down at a B2B environment with your customers and talking about them. At the other end of the spectrum, let me switch to kind of a manufacturing situation where we do have vendors and suppliers in our organization. And in those environments, we actually evaluate the performance of our suppliers, evaluate the performance of our vendors, on-time delivery, meeting the specifications, if you will. And then what we do is we actually either go to our major suppliers, or we have our major suppliers come into our organization and we share our scorecards with them. Usually these are quarterly scorecards, and how well they are doing meeting our requirements. And then we also encourage them to create scorecards about us, because remember, we're asking, we're sending purchase orders to them. Are they clear? Are our specifications right? Are we giving enough lead time to the supplier, and so forth? So we create a scorecard, and then we encourage our suppliers to provide a scorecard to give us feedback on how well we're doing. So that's generally one of the ways that we deal with making sure we meet our suppliers' requirements and they meet our suppliers' requirements as well.
Thank you, Chuck. Any other questions? We can take another 2 questions, and then we have a quick break after that. Any 2 questions? Please put up your hand. only see cameras, but we don't see hands yet. Any hands?
Well, while you're soliciting questions, we have one there.
Fine.
I'd like to ask the doctor, his statistics are impressive on how you have improved. Could you just give us one or two of the methodologies that you used to improve those performance metrics at your in your hospital?
Actually, that mainly but we started from actually 5 years method. Actually, to maintain the discipline and mainly the training. Then slowly we went for the TPM, that means total productivity maintenance and total quality management. Those are the mainly that we applied for the methodology to improve the quality care in the hospital. But later only we got the certificate for the ISO 9001 for the service component. Now we are studying for the EMS, Environmental Management System. Those are the methodologies that we have applied. Thank you.
Yeah. Thank you.
I want to ask this question from the doctor. How did you change the mindset of your doctors and nurses and other staff to change this, the way you treat the patients or customers? What are the steps that you have taken?
I think that is a difficult question to answer, but actually this is the most important question I think that you asked. Thank you very much for asking that question. But the changing of the human resource, that is the very difficult things. But the physical resources, anything that we can gain from anywhere, even from the government. My hospital is a government hospital. Actually, in Sri Lanka, everybody knows that we have free health policy. But there are so many trade unions, human rights organizations, so many things are there. Under pressure of this, all the things to change the mind to achieve this target is very difficult thing. Actually, I have invited so many the people who has the name in the country that they have changed the mind of the people. As an example, I can say Mr. Alphonse, I invited several times. Like that people, I called to come to my hospital and deliver the lecture for the staff to change their mind. And other thing, when I visited in the foreign countries, I videoed myself and show some video presentation. If other countries, if the people in the hospitals, if they are working in like that manner, why we can't do like that way? Even I got example from Thailand and Singapore most frequently. Then like that way, slowly, I think I had more than 10 years, not 10 years, 7 years to change the mind. Slowly, we can't do anything here. But you know, in Sri Lanka, not only Sri Lanka, even everywhere in the world, difficult things to change the mind of the people, human resource. But slowly we changed that. I had to spend more than 7 years to come to that stage to achieve my target. Thank you.
Yeah, thank you. I would think we have all had the opportunity to get very rich insights from the distinguished panelists. And I'm sure we had a lot of learning from Chairman APQO, Dr. Charles Aubrey, His Excellency, the General Commander of the Dubai Police Force, and also Dr. Jayasinghe from the Ampara Hospital in Sri Lanka. And let's all give them a round of applause for sharing with us the insights. Customer experience is important, and I will think you should have a lot of takeaways from here, and go back and do what you need to do to make sure your customers are delighted because of the experience they get from interacting with you. And I would now like to hand over back to the organizing chairman, Ms. Mangalika De Silva. Thank you.
So thank you, Hanek, thank you, Chak, and thank you, Lieutenant and Dr. Jayasinghe. I'll request you to stay for a while in the stage, and there's a small token from SLAQ. And I invite Anusha Rodrigo, the Treasurer of Sri Lanka Association for Quality, to present a token from Sri Lanka Association for Quality. Thank you very much. So I request Dumindu Ranavira to to introduce the next presenter.
Thanks, Ms. Mangalkar. So we go for the another keynote session, and this session will be conducted by none other than President of APQO and also the National Chairman of Australian Organization for Quality, Shan Ruprai. Shan is going to talk about business excellence strategy to hold challenges to quality management. So I believe this will be a very interesting another discussion by Shan Ruprai. Over to you, Shan.
Thank you. Can I have a microphone? Thanks for that kind introduction. As most of us sort of heard from eminent speakers about the journeying in quality and all the goodness that's happening around the world, and they shared their experiences. I still believe that there are a lot of organizations are still suffering in terms of the way the quality is going. So my discussion today will look at that, to where we are. Sorry. Can I have a slide changer, please? Okay, just looking at the history of quality management standards. Australia led the world in 1975 to create world's first quality management standard. It was called Australian Standard 1821, that included design, development, production, and installation. And 1822, and then 1823. We put those standards then on to the ISO, the International Standardization Organization, and then ISO 9000 was born. We had ISO 9001, 2, and 3. There was no reason to have 3 standards, but it was a good money spinner for the people that were selling standards. And now we have ISO 9001, 2008, which is under revision, and I'm part of that committee that's looking at revising this new standard. It's not going. We always have an IT hitches here and there. Anyway, so looking at the standard, so while ISO 9001, the reason it was born was to look at internationalization of the trade. So the products that can be manufactured in part of the world can then be easily accepted by the other part of the world. And the Western world outsources whole manufacturing product back to the Asian region. That is done for economical reasons as well as for environmental reasons. It's also putting responsibilities back onto where it belongs, to getting away from the inspectorial role to more civilized quality management systems. Better planning, but there was also a law of the jungle. Certification bodies that preached quality in certifying some companies, they did not preach quality themselves within their own organizations. So we wanted to make sure that they was independently accepted around the world. So while that's just looking at that, so let's look at now, where is this certification going? Looking at these figures now, let's look at Sri Lanka. Can somebody please fix these? Okay, so we can see there is a drastic decline in the certification of 9001 in Sri Lanka from 2009 to 2010. That is trying to tell us something, and what it is. Let's look at that. I'm sorry, I know we're running out of time, and can somebody please fix this? This one? Right. So looking at ISO 9001, we can see 178 countries' economies are related to ISO 9001. So while that's the case, let's just look at how ISO 9001 certification is growing. You can see there's a major decline, from the early days to 2010. That's again trying to tell us something, that there is a challenge to quality. And who are the main countries that are leading certification in numbers? China is number one. And that really tells us the actual figures, how many companies are certified in each of those 10 top countries. I've got a lot of slides in here, which is in your handout, so I won't go through the whole lot, because there is a very nice program after my presentation, which I'm looking forward to it. So have a look at those slides that are in your handout. So what are these certification challenges we have? Initially, the accreditation agencies, who in turn accredited certification bodies, they were fully funded by the government, especially in Australia. But the government changes, they have to now generate their own revenue. What that does, when the money changes hand, customer-supplier relationship starts. And that's happening with certification bodies and the company they're certifying. So they do become customer-supplier. And the government policy forced people to be certified. That means some of the consultants became consultants overnight. And while they had no knowledge about designing and implementing systems, auditors weren't capable of auditing properly. I ask you in this room, how many times an auditor has come to your organization and asked you to show me your customer contract? Hands up. That's what I expected. 98% of the time when the auditors come to audit your business, your company, they never ask, or they hardly ask, for a customer contract. And if they haven't seen that, how can they justify the auditing? So quality profession itself needs to change. And some certification bodies want a bigger share of the market. And that has its own issues. And that leads the customers asking, what's in it for me? Am I getting any benefits out of the ISO 9001 certification? The regulators are asking the same question. To fix that, of course, we lobbied the federal government in Australia. We created JASANS. JASANS now self-funded. That means money changing hand again. So what are the current barriers in quality management? Now, ISO 9001, yeah, I'm a believer in that, but that does not have all the solutions to manage end-to-end business. So we're here to manage the business, not just certain part of the business. So it has the barriers. And there is no site or a discussion anywhere in the world to create a standard that will address business requirements from end to end. And integrated management standard. Again, England's talking about that, but I don't really see anything that will happen in the near future. And there are limitations to certification as well. And there are global cultural differences how the certification business takes place from one country to another country. It is a very high cost to be certified, and as well for certification bodies to be able to manage their businesses. So while the Western world is outsourcing its manufacturing and the foundry business to the Asian region, what we're doing is we're really trying to squeeze the manufacturers in the Asian region to reduce their prices. So the Asian market itself is now trying to compete among themselves to reduce the price. So what happens? As a result of that, quality suffers. So I guess to change that particular scenario, it will be good that if we can have a quality or a regulatory body that can see that and oversight that process. Madam Tang in China is doing a great job in lifting the manufacturing of quality within China. But perhaps APQO in years to come can look at that to be part of, in partnership with a regulatory body to ensure that we can create a win-win situation in this part of the world. So while we got all this, the poor quality manager, he and she has to think about meeting return on investment, need to think about meeting all different parts of requirement of the business, stakeholders, vision, mission, and all that sort of stuff. Makes the life really, really difficult. So we do have challenges to quality. So while we're going through a global financial crisis or issues, and the life of an average CEO in anywhere in the world is about 5 years. So what does the CEO does in 5 years? Try to cut costs, make themselves look good, and move on. And that's where quality suffers. And there are other issues. The quality profession itself needs to learn how to engage with the people at the board. I know there was a question today about, okay, we talked about certification 9001, TQM, Six Sigma, and all that. Where is quality heading in future? It's a big question. We can't keep talking about the same things while the world is changing. So there's a lack of skills in the quality profession itself. And of course, there's enemy within the quality profession. I have seen organizations around the world, in some countries, where two quality organizations are fighting among themselves, or trying to compete with one and each other. So we need to really look at forming partnership, supporting each other for the good of the community. Okay. Now, there are two groups of people that are always right. One is the voter who keeps the politicians in their seats, and the other one is a customer. And it is nice to get people to do what you want them to do, but it is good to have them want what you want. Once we achieve that, I think it becomes a little bit easier. And we live in a world that's going to always change. So there's no question about that. Reform is going to continue. And no question about that, reform, just do it. And what role quality is going to play in that, in this ever-changing environment? Now I'm going to give you an example of the model that I implemented in Australia at a large scale. The business excellence strategy that the model that I have. Now, this model can be modified to implement in any organization, smaller or medium. So the population of the New South Wales is 7.3 million. So we have 7.3 million customers that we need to serve. And it's the largest state in Australia. So, and our total budget, not for the whole government, only for the services is $60 billion. And our expenditure on the model that I implemented in terms of the shared services, where we provide services like human resources, procurement, IT, and finance, just looking at those four. And in this government, we have 160 departments. So when we looked at government as a whole, it's quite interesting. You know, there were 44 human resources and workers' compensation systems. 44 systems in one government. 16 procurement systems. 33 financial systems. 14 records management systems. So this area begs for reform. It's making life really difficult for people that work within it. And of course, we live in a world where the governments want to cut the budgets because the voters and the community want a better service from the government. And the way it can be done is not necessarily cutting down the staff, but to be more efficient. And that's part of my discussion that I'm going to talk. So, before we went on to developing a strategy to reform the process, we wanted to make sure quality management played a very strong role from A to Z. So quality is not just ISO 9001. It's not just Six Sigma. It's not just continuous improvement. These are the tools we utilize. So we scanned the environment, and we did comparison of other private sector organizations and public sector organizations that have gone down that path, and looked at their failures. We looked at their successes. And from there, what we did, we developed a blueprint. In developing that blueprint, we consulted each of those areas, 160 areas. We held workshops with them to explain to them what we were going to do in this reform and how quality management is going to play an important role. We produced an interim report. We got some feedback on that, and we published the final report, how the reform was going to work. And we made sure that we had a very strong business case. Again, this is where the quality profession needs to really shift its thinking and start grasping these new skills in developing business cases. Then we had a project management. We had executive support from the leadership. You heard that from Chuck and many other speakers. And we were looking at logical standardization of the processes and technologies. So after doing that, we converted 160 departments into 9. Massive task. 9 clusters. And when you look at the full-time employees, for example, in education, we had 98,000 full-time employees. So obviously, it's going to impact a lot of people, this particular reform. But if quality management is part of that, we can make sure that it's going to work and it's going to function properly. This is quality assurance governance framework we put into place, where we made sure that quality manager for the whole government was continuously speaking with the 9 clusters. And the reporting was straight up to the expenditure review committee of the government that was looking after the whole process of budgeting. So this picture really defines the scope of quality assurance strategy. That really looks at in terms of blueprint, went through a proper quality process, the business case. So defining of our quality program looked at in terms of blueprint, business case, benefit realization. What benefits were we going to get at the end of the day? and stakeholder management plan, and other scoping documents. Then assuring the quality and accepting the outcome from the strategy in terms of quality. We looked at the product meets quality criteria. Benefits were realized, and other planned outcomes were also achieved. Then in terms of looking at establishing the capabilities, we looked at people, systems, processes, KPIs, and tools. And then looking at the assessment of the compliance, the outcome to be measured properly. So you can see all these principles do relate back to the APQO, Global Performance Excellence Awards criteria, leadership, measurement, processes, supplier, and all that sort of criteria. So how did we really standardize? We looked at the world's best practice into 4 areas: procurement, HR, IT, and human resources. Because it's a big elephant. Only in these 4 areas, we looked at the world's best practice, where in a best practicing company, it was only taking to process 1 invoice $4. And our cost was $47. So it's a big difference. So yes, there's a public sector mentality and all that sort of stuff, but we needed to move on to increasing efficiency without losing staff. So there is quality plays an important role here to be more efficient than to just cut down the cost. And then we standardize those best practice procedures and process maps to meet our government requirements. Then we benchmarked. There's 4 tiers of benchmarking that we introduced. One was at the local process level, then at the department level, cluster level, and we produced the whole government report in benchmarking that we were able to demonstrate as a whole government how do we rate against the best practicing organizations around the world. Engagement and change. Because a large organization, we made sure the engagement and the change process was working very well. Looking after our staff. The biggest asset in any business is people. And if we don't look after our people, we can't really successfully manage anything. So their training and all that sort of stuff we looked after. And continuous improvement using tools like Six Sigma, Lean Sigma. Continuous improvement is not just set it and forget it. It's an ongoing journey. We need to make sure that those benefits are going to stick, and it's going to continue. Reporting framework was another very important part of this reform, where we did the auditing, measurements, and clearly defined what was going to be reported, how often it was going to be reported, and who the report was going to go to make sure everybody was kept honest in this process. We had traffic light process in place to make sure the savings, we are looking at $487 million they're saving every year. And we wanted to make sure those savings were available and they were measured at the time they need to be measured. And if there's any issues, we use those traffic light signals in there to look at those things. Benefit realization. You know, politicians love to see that what benefits they're going to get out of this. So we were measuring that what benefits were achieved and how they were achieved and how they're going to be tracked. We did look at the governance process, which is very, very important. We made sure the people at the board level, they were fully aware what their responsibilities were, and they were not interfering on a day-to-day running of the process for us to manage. And we made sure the people in the board were also continuously trained. Because often what happens is people go on gain a position on the board, but they never get training as the process changes. So made sure that was part of the process to go forward. And we talked a fair bit about vision, mission, values, and strategy, important parts of any business. We made sure that these 4 things were really part of our business. In case, if the vision was missing, there will be no enthusiasm. There can be a shift in strategy year after year. If the mission was missing, there can be confusion. And if values weren't there and they weren't understood, employees sometimes can take the vision too far. And if the strategy is missing, corporate goals, they're not linked to employee behavior, that it can create its own problems and its own issues. We did psychometric analysis of our staff to make sure people that had the ability to be in research and development, they were positioned like that. And people that were good in strategy, they were part of the strategy team, and the implementers were in part of the implementation team. We scanned the environment of similar businesses and governments around the world. And so I've got a hand up. So we created our vision from there, and then that was underpinned by the mission, strategy, and the values, and that actually drove our executive agenda. We didn't shy away from designing our processes. We got our teams together. We make sure the team understood what they're there to deliver, KPIs and measurements, and how did they added value, return on investment. And what we did, then we tried to capture the whole management system into one figure. Try to do that in your organization because it has a really major impact to capture that into a soccer ball, because soccer is very famous in Australia. So we created a ball that looked like a soccer ball that had all those things in there. But it doesn't just stop here. We're looking into the future. We can again outsource some of the things we got now going forward. And we measured those through appropriately KPIs. We replaced our plan, do, check circle that we normally had, and we put in there our own soccer ball, because that is the part of our improvement process going forward. And we set up clear KPIs for quality, safety, environment, food safety, and finance to make sure they were all measured and they were supported. List of the stakeholders to take away with you that we consulted. And we made sure that the input was sought from the appropriate stakeholders. We were mindful not to create a bureaucratic system. Quality means different things to different people. So we made sure quality, what was required for this purpose, was created. Teamwork, we made our decisions on scientific data, not just because we felt like it on one day. And of course, we had a think tank which was based on innovation and did all those things with the enthusiasm, warmth, and we were tough, but we were fair. Policy, again, policy was created in consultation with all stakeholders. It wasn't done in isolation. Communication, again, we communicated with every single stakeholder we identified to make sure they understand and they were with us all along. Continuous improvement, downsizing, right-sizing, we're fully aware of that. We made sure objectives were met. And we made sure the processes were fully under control and they were managed. Vision, we made sure the vision was understood at each process level. And redesign, key issues we looked at in terms of issues that are coming up in process management. And we looked at what are the internal things we needed to manage and the external. We had a charter of ground rules, which you can read at your own leisure. And we made sure that our benefits were going to stick in the long term. They weren't just temporary. Do it and forget it in 2 years' time, we don't have any benefits. The last slide. So by doing that, we were able to reduce non-conformances or stuff-ups within the government by 15%. 20% improvement in productivity when you talk about $16 billion budget. And of course, we need to sustain the benefits in going forward. A better morale, 18% reduction in the sick leave, a better governance and return on investment. So if we do all those things, we can celebrate the success of quality management. Thank you.
Thank you very much, Shan, again. And yes, I think Shan receives another round of applause because he has been there for us not today. Starting from Saturday, he has been conducting series of sessions for the benefit of all the people around here. We have a small token of memento to be given away to Shan. So I would like to call upon to give away this. I would like to call upon the Assistant Vice President of Sri Lanka Association of Quality, Mr. Janaka Jayasinghe. If you could join us, please. Yes. Thank you very much, Shan. Right, so it's break time. I know some of you have been a little bit hungry and sneaking out to have a little bite of food. That's okay. So we're going to have a short... Yes. So we're going to have a short break for 10 minutes, and then we are going to have the final presentation for the day.